All right, guys, this is supplemental to the PowerPoint you've been going over on the SI joints. So one trick with the SI joints is actually mobilizing the hip joint. If we're always bending, breathing, motioning from this SI joint, the hip is often very restricted, and then our shoulders do a lot of work. That's how the neck gets connected to the foundation. Shoulders are trying to decompress. They're trying to do a lot of the breathing, and that aggravates the lower back. It can make it very weak. It can make rigidity appear up here. So mobilizing these hips, and often the ankle is another big part of that, will help us stabilize. So as a little warm-up, help you work through that. The first one we got is the bicycle reach, and you can do this with a little tennis ball if you want. You can probably cut it in half so you don't have to do the whole 10 each side, maybe 5 each side because it's a little rough. You're going to put it right in that piriformis muscle. Bring both knees up about 90 degrees. I'm going to plant my right elbow. Reach, strong core. Get in there. And you just position that tennis ball where you feel a good stretch. Otherwise, even without the tennis ball, you're rolling up on that hip. You're going to feel a good massage right there on those external rotators as you come up. We're going to go through a good 20 of those. Think about your breathing. Pulling that knee towards me, getting a little hip hinge. Rolling up on that hip joint. Core is strong. It's like if you round a little bit in the mid-back. Just keep that lumbar spine nice and lengthened. Don't be flopping the knee there. Don't be super compressed. You're pulling that up. Pushing that other leg away. All right, so the next one we got is the butterfly sit-up. So one leg's going to be in your butterfly position. Let me do my right. You can start up here if you want. Good little stretch. Working up to this, you can kind of just pull yourself here and rest. But this is the ending goal. It's the knees driving forward. Foot's kind of pressing us up. So we're coming into the sitting position. Rolling up, core strong. Let that go forward. And you'll probably get better at this even than me. Let's switch that up. Goal is to kind of slowly unravel the spine. Don't be too rounded. Pull yourself up. Again, this is pretty tough. So if you want to just hang out here, do some impulses, that's good. So we'll go 5 each side there. The Hinge Curtsy, we'll get up. Decompress, really spread those fingers, engages the shoulders, trace up, pin down. I'm going to hinge into this one. Right leg's going to come behind. You're not putting the knee down. You're going to put the hip down. And the foot's going to push you out. Hinge, stay in the hinge. Cross. Back up. Hinge Curtsy, 5 each side. And the beast kick, you can kind of break this down slowly. Think downward dog, you're just kind of pulling into this position, loading your hip joints. You're gonna bring your right foot outside of the right hand, kick the left leg through. Back up. So you want to take this slow. You can even just stop here and back. Stop here, back. You can even do what we call the Spidey lunge. Add a little thoracic mobility there if you want. Once you get good at those, work on kicking through. It's good little hip motion. Warm up those hip joints. Loading, lengthening the spine, kicking on through. Should get you a nice little burn deep in the hip socket. That's what we're going for, and that's your good warm-up right there. So after you've done your warm-up, you're looking to add some weight. Maybe even do a little foundation training midway through, just to help go over your principles so you can apply them when we're handling the weight. The foundation training principles are going to help you stabilize the sacroiliac joints, but even adding weight should increase our load tolerance. It's our body's ability to lift up against a weight. Sometimes we forget how much weight we have. We're just always compressed. The spine's compressed. We're resting on the joints versus using the muscles to drive up. And that comes from the feet to the hips, all the way up to the neck, connecting a lot of these dots. Feeling good hamstring tension, the rector spinae, which do go up to the ribs, but even up to the skull, should have some good tension throughout these different moves. But again, they're to mobilize the hips. And we'll do a lot of one-sided activities so we can really find out what hip is rotated or stuck more than the other, so we can take care of those rotational imbalances. Because rotational imbalances will cause one sacroiliac joint to be unstable compared to the other. So sometimes one is closed, the other one is too open, making the tendons that insert there susceptible to injury, or even worse than that, the deep sacroiliac joint getting damaged, which that inflammation, that chemical reaction on the nerves creates irritation over time. It gets weird muscle pain or sciatic type pains or even organ dysfunction just from not moving correctly. So the kettlebell reverse lunge, I like the figure 8 position, but if you're going to do it just in a goblet squat, you can hold it right here. Just make sure you're not rounding or arching. So the goal of the figure 8 is to keep you kind of honest. So you're putting that knee down, and I'm staying in the hinge. So the bell is just making a figure 8 pattern. Come behind the forward leg every time. Big and tall. Don't have to tap the knee, but I do want you to think about putting that knee down on the back leg. Otherwise, if that's too confusing, squeeze those elbows in, fold over the front hip. Drive straight up, body's resisting that weight. If it's too light, that's when you tend to just rest into the joints like that. It's not what we want. Fold over that hip. Chest big or hinging back. Hit that uncomfortable fascia surrounding that hip. Turkish get up. So you do 20 of those. Turkish get up 2 times each side because it's the big movement. So my left hand's holding the bell. And press it. Left knee bent, right straight. Use your elbow to curl up. You're doing a sit-up. Pressing that towards the ceiling. Getting the arm underneath you. Scoop that behind. Eye on the bell. Drive up, reverse that position. That wasn't very pretty. Let's do the other side. If you want, you could just power through another set. Or reset the other side. See if we can slow it down. There we go. Don't plop on your butt. Even coming down here, kind of slowly set yourself in. So that one more time. Press. Press off. Hips doing a lot of work. Keep your wrist locked. Slow and controlled. Peel that spine down to the mat. Good, let's even it out. Total of 4 right here. Pressing, lifting, up, There we go. There we go. All right, next. Forward lunge with the kettlebell. Handle underneath your occiput bone. Stand at the edge of your mat. Big step forward. We're going to squeeze those elbows wide. Handle behind the kettlebell. All right, it's the skull behind the kettlebell so your head doesn't arch or flex. Keep it in contact. Big step, let the knee travel forward, drive out. Big step, let the knee travel forward, drive out. Not trying to drop the knee down to the mat, trying to keep the back leg straight. Come back. Back straight. Drive out. Good. 5 each side there. Single RDL. Romanian deadlift just means one leg. So if we got the left leg planted, I like to just kneel or knee that kettlebell to engage the core. That's your psoas. It's going to stabilize lumbar. Get your skull big and tall. Let that leg travel back. Maybe even stop right before you hit the ground. Kick that leg out, come back up. 5 each side here. Switch sides. Core strong. Come down. Keep it shaky, test your balance. That little setup here, just like our internal trace, it's going to activate hip coming across the body, sets the hip in internal rotation, but also engages your psoas. So when you do kick out, you don't arch your back. You keep that core stable throughout the movement. Watch your neck too. Don't arch, don't flex. Then you'll finish up with some squats. Easy. Hinge. Swing that bell up, catch it, pin that close to your chest. Goblet squat, you're driving the knees out. Drive them out as you press up just a little bit. It doesn't have to go all the way overhead. Big breaths. Just that little nudge. Your hips are driving the weight up. You're not arming your way through that. Let the legs do the work. Let your hips do the work. 10 each side. Repeat that many rounds as possible. 15 minutes.